In today's webinar, I'm so excited. We're going to be discussing culinary psychiatry with Dr. Uma Naidoo. I'll introduce myself briefly first, then introduce Dr. Uma, as well as talk about some housekeeping items, and then we'll dive in. So, my name's Charlotte. I am the lead nurse practitioner and one of the first patient facing clinicians to work with Outro. I've been consulting with them on integrative and mind body medicine since 2022. And I'm so excited today to have Dr. Uma Naidoo joining us. Dr. Naidoo is the most recent addition to the Outro team. She's joined us as our advisor of lifestyle medicine in her pioneering work in culinary psychiatry. She is a Harvard trained nutritional psychiatrist, director of nutritional, lifestyle, and metabolic psychiatry at Massachusetts General Hospital, and also the best-selling author of Calm Your Mind with Food, a book I personally love, and This Is Your Brain on Food. In addition to this, she's also a trained professional chef, part-time culinary instructor, and nutritional biologist. So we are so lucky to have her today to discuss some of her work with us. For those of you who are new to the Outro world and the Outro community, allow me to warmly welcome you. Outro is really, we're trying to become more than a tapering program, but a path back to ourselves. We've got adaptive taper plans, expert clinical support, and resources to manage withdrawal. And so we really want to help your move off of antidepressants be safe, steady, and with the confidence that you're understood every step of the way. We do webinars, including presentation-based and Q&As a few times a month here at Outro and spotlight unique voices in the wellness space or the taper community. And so this information is educational and a free resource. We share it out on our YouTube channel as well as our social media accounts at Outro Health across all platforms. And then one last thing I want to say is that today is World Mental Health Day. I think it's a good time to just take a moment on World Mental Health Day and pause and remember that caring for our mental health, it's not something we do once a year, but it's something that's built from small, everyday choices. Here at Outro, we really see how healing starts with simple shifts like slowing down, connecting with others, and most importantly today, paying attention to how we nourish ourselves. And I'm so glad we get to explore that connection with Dr. Uma today. How are you today, Dr. Uma?
I'm great. Thank you, Charlotte. Happy Mental Health Day, everyone. And I completely agree. It's something we should be doing every day. Mental well-being is so much a core part of how we function. I like to remember that.
Absolutely, absolutely. And so that really brings us into my first question for you, Dr. Uma, which is this idea of lifestyle medicine, nutritional psychiatry, and culinary psychiatry. And I was wondering if you could speak on your experience and kind of the definitions of these terms.
Sure. So, I really felt that, well, let me share how I define nutritional psychiatry. Nutritional psychiatry is the use of healthy whole foods and nutrients to help your overall mental well-being, and it works in synergy with other important forms of treatment like medications, different forms of psychotherapy, or any other prescription that your provider is offering you. And that could be some kind of other therapy, vagus nerve stimulation, and so many others, as we know. So it's really meant to be very inclusive and help, because nutrition is such a major pillar of lifestyle medicine that it is there to support your brain health, your mental well-being, as well as your physical health. Culinary psychiatry is a newer and emerging part, which is really helping mental health providers use the evidence-based knowledge from nutritional psychiatry in the kitchen. First, teaching them recipes and how to work around the nutritional facts in food, and then being able to help patients directly and consumers who really want to know, how do I make a healthy breakfast loaded with brain healthy nutrients that's made from whole food? An example of that could be if you plant-based tofu scramble, if you eat everything, an egg scramble loaded with spinach and different colored peppers and spices and herbs to really make it nutrient dense. Eggs are rich in choline, and that's a really important nutrient for your brain. So just an example.
So interesting. And what inspired you to follow this path into nutritional and culinary psychiatry?
I think that growing up as a child, when I was very little, I was born and spent my very young days in South Africa. Despite all my training and my qualifications, I was a preschool dropout. I just want everyone to know I refused to go and somehow got away with it with my lovely parents who said, sure, And my reason as a child was I wanted to hang out with my maternal grandmother. My first book, This Is Your Brain on Food, is dedicated to her. And she was so much fun. She was always cooking and growing vegetables in the garden and having delicious meals. So I much preferred to spend time with my grandparents. But that taught me so many important principles in life that I didn't realize. And it was just sort of naturally healthy eating. Where do whole foods and plants come from? The ground. When a child is helping to pluck vegetables from a garden, they remember that and they absorb that information. So I entered the world with this very holistic approach to eating and to life because, again, not being in preschool, my grandparents had to find things to entertain me, and that's how I learned yoga and meditation as a child. So when I was at Harvard studying later on in my life, I kept thinking, why are we're talking about such powerful medications, which I, as a prescriber and as a clinician and as a doctor, have definitely saved the lives of many of my patients. But it is not the only solution for everyone, which is exactly what I like about working with Outro Health, that we are offering more solutions for people. Certainly, especially individuals who struggled for years just not feeling better on many medications. So that being said, the gap for me, Charlotte, was why aren't we talking about other ways to help people feel better in addition to medications? Why can't we also be asking what they're eating? What about their exercise, their lifestyle, their routine? How much water are they drinking? Hydration is so critical in conditions like anxiety. And I just started to observe that gap until someone in my practice really alerted me to the fact that I needed to lean into that more. And I started to bring the conversation in, and really that grew over time to opening the first clinic at Mass General years ago. To really offer this type of consultation for individuals who really met the criteria. We have to be careful about screening. And that was really how it grew. And I was very, very blessed that it went in that direction.
Yeah, absolutely. I've heard it described as, historically in psychiatry, there are these two paths up the mountain of wellness, medication or therapy. And
Yes.
this idea that we can use those paths, but also building in other avenues and other ways up the mountain, other hiking paths, so to speak, is so important. Correct me if I'm wrong, but can you talk about what the state of nutrition education in the medical system has been historically? Because I think this is the first nutritional psychiatry program that's available for physicians. Is that correct?
The training program that we started at Mass General, yes, that's CME based for providers. So nutrition education is dismal in the United States for doctors. Okay? So if you're a nutritionist and dietitian, you are getting well educated, whichever school you go to. But if you're a doctor, only 20% of US medical schools teach us any adequate amount of nutrition. So I really had to find a different path to learning nutrition that was not through medical school. That being said, we really are trying very hard to expand that for clinicians. Of certainly in mental health, it's not just, you might see a prescriber who may not necessarily be a medical doctor, and we need those resources. We need more people in mental health to be supporting the community, and everyone needs to know a little bit of nutrition. So culinary psychiatry provides that cooking component that connects to the nutrition based science behind food, but nutritional psychiatry offers principles that you can use in your clinical practice. And, I think that it's not surprising that when you speak to a doctor, whether they're a psychiatrist or not, they don't really know much about nutrition. It's because we're not taught it. And I think we need to fill that gap.
Absolutely. I know that that's similar in nurse practitioner education. There's very little nutrition counseling provided for clinicians. And that brings me to this question of what a clinical practice looks like for a nutritionist, nutritional or culinary psychiatrist. How does your practice look?
Sure. When my clinic was actively running, because now we've really pivoted into building resources to train more clinicians, because as I like to say, there are lots of good people trying to do this work and helping to do this work, but you can't be an army of one. You've really got to build a community of providers who can do this. And another reason to be working with all of you, Charlotte. So typically it was really by referral. And the reason for that is it worked like a tertiary care clinic, meaning you might have been seeing a primary care doctor, an orthopedic doctor, an immunologist, an infectious disease doctor, and that specialist knew about our referral service and would send a message with, presenting the questions on behalf of that patient. Sometimes it was individuals already seeing a different psychiatric provider at the same hospital, but wanting to understand what can they do to optimize how they were feeling. And then the individual would meet either virtually or in person and go through a psychiatric evaluation evaluation, but in addition to that, really a nutritional and lifestyle component while focusing on elements of metabolism. It's comprehensive, but at the same time, what we really want to be able to do is provide real life solutions for people. The other thing that we trialed at our hospital was a shared medical appointment visit with screening, carefully screening individuals who understood in a group setting they would be talking about a combination of medications and nutrition and lifestyle. And this was based on a program called the SMART program at Mass General. And we trialed that, and we really would like to be able to offer that on a regular basis. Of course, it's through our hospital, so you'd have to be a patient there. And that's an online, private, confidential group setting where you agree that you are going to have a discussion with us, say about, we talk to you about a different module, how to eat better, how to sleep better. These are some lifestyle factors. And then we work together as a group like you would other group therapy, but this focus is on nutrition and lifestyle.
Naomi in the chat said, the first and what an exciting thing. I feel like it was a long time coming, but we're just so excited it's happening. I think that I reflect that sentiment exactly. Before we dive into we've got some more specific questions about nutritional psychiatry interventions. I was wondering if you could take a moment to speak about the relationship between the brain and our food and this gut-brain relationship, since that informs, so much of this work.
That's a great question. So one of the mechanisms to help us understand nutritional psychiatry and the mood-food connection starts with the connection between the gut and the brain, or the gut-brain connection. So I like to say two things. One is the gut-brain connection unfolds and explains the mood-food connection. And I also like to say that a happy, healthy gut is a happy and calm mind, because these are real biological connections that exist in the body. One of the mechanisms that I like to explain in nutritional psychiatry is that the gut and brain originate from the exact same cells in the human embryo. And although they're two separate organs that live far apart, that look different, they arise from the exact same cells. They are then connected by the 10th cranial nerve, and the 10th cranial nerve is the 10th vagus the 10th cranial nerve is the vagus nerve. And the vagus nerve is really like a two-way messaging system between the gut and brain, sending neurochemical messages between these two organs. The way that the gut-brain connection is impacted, one of the things is how we eat. So if we're eating a fast food, junk food diet that's mostly candy, cakes, and fun stuff that is less healthy for the brain, then that drives inflammation in the gut. Inflammation in the gut over time will lead to inflammation in the brain. It doesn't happen immediately, but it will happen over time. That's when you see a real uptick in mental health symptoms, as well as other things. It could be skin conditions, it could be other stuff, but you definitely see an increase in more depression, driving symptoms of OCD, worsening PTSD, increased anxiety, poor focus. Another way to think about this is, if you have a headache, you take a headache pill. You don't dissolve the headache pill and rub it on your head where you have the headache. You swallow it and you drink some water, and hopefully 5 to 10 minutes later, the headache goes away. In a similar way, ingesting food, the way that headache pill traveled through your system. In a similar way, we chew our food, we digest our food, it goes through the gut, it interacts with the trillions of microbes down there. Ultimately, the breakdown products not only nurture us and nourish us, but some of those products also reach the brain. So it's one way to start to unpack this system. And there are other mechanisms as well, but that's the one that I think makes the most sense to explain to people before diving deep into it.
Absolutely. And, the foods that we eat are the precursors for all of the neurotransmitters and the building blocks of everything. So it makes
That's right.
total sense. In terms of a specific question for people who are tapering, so gut and bowel issues or symptoms are things that we commonly see. And I'm curious if you can speak on any potential tools or practices or ways that you might think about navigating a gut or bowel issues that are feeling a bit off while going through a taper off of psychotropic medication.
It's a great question. I think that it starts foundationally with, can you in some way clean up a little bit of your diet? No one's a perfect eater, that includes me. So are there things that you're doing that you could improve a little bit? No one wants to make drastic changes. No one wants a list of 10 things to do the next day, because it's hard for any human to do that. Say during COVID, you picked up an ice cream habit, as many people did, being stuck at home and all of that time, a lot of families or even individuals bought ice cream every night and they would have a bowl or two of ice cream. Well, we're a few years out now. It's time to replace that ice cream with, a healthy ice cream made from bananas, which you can actually do. And you can even make it chocolate flavored. And the recipe is in my first book, and that's why I know, and I'm happy to share it. But in other words, can you take one habit and change it? Maybe during COVID, your family bought a bottle of wine to dinner every night, and that became a habit. For someone else, it might have been, oh, I gave up my gym membership, and well, it's hard to go back now. I'll try exercising at home, but you actually pull out the iPad and do a virtual class. Not so sure. So I think it starts off foundationally with what other things you can do to improve your lifestyle and your nutrition to help the deprescribing tapering process. I think it could even be hydration. I would suggest people start there. The reason I say that is the gut and the gut microbiome and the trillions of microbes, they perform. The reason we want to take care of them, like I like to say, if you had a guest in your home, you generally take care of them. You wouldn't expect them to wander in and just find the shower on them on their own and stuff. You take care of them similar way. Those trillions of microbes, we want to take care of them. We want to feed them with fiber. Fiber actually nourishes them. We want to take care of them because they are involved in vitamin and hormone production, sleep and circadian rhythm, immunity, mental well-being, and so much more. So when we improve our gut health, we start to improve everything else. That includes any side effects, difficulties, gut discomfort that you might be experiencing while tapering or deprescribing. So I think it's a good place to start. And I think that if you continue to slowly make some good changes toward healthier eating and healthy habits, including things like less stress, working in your stress level through a breathwork exercise, through a yoga practice, whatever helps you do those things because it will help your gut health and that will help the process of tapering.
I love that. And I love the idea of thinking of all of these microbes as guests in our home. That's a beautiful way of looking at it. And what I'm hearing is this idea of small, reasonable shifts over time
Mhm.
rather than big overhauls. And that kind of brings me to my next question. Somebody asked for fussy eaters or those who are pickier eaters. What
Yeah.
simple steps tend to catalyze and motivate new diet habits?
A simple thing can be, I mentioned a swap, making, if a person is so-called a picky eater, they would know the things they're willing to eat or not eat, right? So even if they start with, hey, I'm picky about eating this type of vegetable, or I'm not eating that vegetable, can I find a vegetable that I like? I don't like broccoli, will I eat cauliflower? I don't like cauliflower, will I eat green beans? What can I do? Vegetables, there's so many of them, it's easy to choose. So that would be one thing. But the other thing that's really that I like a lot is what can I add? What can I add into my diet? And here I would say easy things to add is can I improve my sources of protein? If you're plant-based, it could be tofu or tempeh. If you eat everything, it could be seafood. Salmon is a great choice, rich in omega-3s. It could be chicken or beef. Could I up my protein? It could be beans and legumes. But it could also be, can I add in more fiber? And can I add in fiber through easy things like beans, nuts, seeds, legumes, fruit and vegetables? Could I add in an extra serving? Can my snack be a clementine with a piece of extra dark chocolate? Not a candy bar, tiny piece of chocolate, which actually dark chocolate is actually good for our brain. People also feel less deprived if they can add something in. So that's sometimes a good place to start. And if you're a more careful, picky eater, then you'll know the things that you're willing to add in. So you might have to change the vegetable group or which type of berry you like. You may not want to eat that at all. You may only want to eat a certain type of protein. But remember, the more wholesome and the more number of whole foods from different food groups that you bring in, the better for you. So I would suggest starting there by adding in something you're comfortable doing and paying less attention to getting rid of something else.
I have to say, I'm very excited to try your banana ice cream recipe. I am someone who was an ice cream eater during COVID, so that really hit close to home.
It's a great recipe because people love chocolate, and you can actually make it of chocolate flavor. I kid you not, and you can add blueberries and nuts and really make it pretty yummy. So no, it's worth the try. Is it going to ever be exactly what full cream ice cream is? No, but we can train our palate to eat something that's better for our brain.
Absolutely. Matt in the chat says, I'm craving chocolate like mad now. Me too, Matt. And, that brings us to another question. I've heard in some of your other research talking about certain minerals, vitamins, nutrients that most of us or many of us are deficient in. What are some natural foods that contain minerals and vitamins that most of us or many of us have deficiencies in? That if you were to pick a couple superfoods to say, let's incorporate this into a diet plan for someone who eats doesn't have any dietary restrictions.
So I think that some important brain nutrients. I mean, we know that the foundational things we generally talk about are things like omega-3 fats, which you can get from seafood. You can also get it from plant-based sources, chia seeds, flax seeds, those types of things. Those are less well absorbed, but if you are plant-based, you can always get a algal oil vegan supplement, because in that instance, if you're not obtaining enough through plant-based sources of short-chain omega-3s, you can consider supplementing it. But you might be okay with the way that you're eating. Another important and foundational food are leafy greens. They're rich in vitamin B9, which is folate, and studies that are literally 30 years old now, done at Mass General by my mentors, show that low folate is associated with a low mood. So if you think about a simple thing like just making sure you always have leafy greens in your day, spinach in your eggs, spinach and another leafy green in your eggs with chopped veggies, having a nice different green salad, but with lots of vegetables and your choice of baked salmon or tofu, with whatever it is you eat, but making sure they're a good foundation of your day, because they're pretty low in calorie, they're easy to prepare, and they are giving you a good amount of folate. Don't overeat it, as with anything, but have enough healthy servings in your day. Another group of foods that I love to suggest to people are herbs and spices. They are simple, powerful ingredients that if it's a pure spice, there's really no unhealthy ingredient in it. And they have rich anti-inflammatory and antioxidant properties, but also some spices have specific impacts on different conditions. Studies of saffron, which is why saffron is added to several mental wellness supplements, is saffron has helped mood and anxiety. But the amount of saffron we put in food, it's usually a few threads and it's an expensive spice. It's really not enough what we put in a certain dish. So that is one place where I think if your doctor thinks it's appropriate, if your provider thinks it's appropriate, finding the right mood uplifting saffron supplement may be something that you consider and think about, because in the supplement there's a higher dose of the saffron. So that's another group that I love.
Very, very interesting. And Tammy in the chat had asked about your thoughts on seasonings, mentioning saffron with its
Yes.
health benefits. Are there any other herbs or seasonings, or if you wanted to add in saffron to your regimen, maybe how many milligrams about, or would it be individualized?
So I would defer to, because in food, you're using only a few threads or quarter teaspoon of saffron is really not sufficient. It's great for flavoring. It's great for color, natural color. It's got that beautiful hue. I would defer to a quality supplement on that. The way to look up the trials or the validity of a supplement is the site that I have used is Consumer. I think it might be subscription based, but they will show you the well vetted studies and the supplement that has had problems or not. And I would start there. So, when you're looking at a supplement, always be careful to look at the reviews, see who's making it, get it from a well vetted source that is careful to formulate it, look up an organization that vets these supplements since they're not FDA approved. But saffron has definitely helped a lot of people.
Absolutely. And are there any other spices or seasonings that you love for mental wellness or that you'd recommend for our patients?
I'm kind of like, I love all spices, but here are a few which are really super good. If you like spicy food, anything that contains chili pepper or capsaicin is actually not only energy providing, it's flavorful in your food, but some people don't necessarily like spicy food. Turmeric with a pinch of black pepper, the addition of black pepper, the piperine in black pepper makes the active ingredient in turmeric about 2000% more bioavailable to the brain and body. Easy hack. You can, if you don't cook with it, you can add it to a tea or soup or smoothie. Other things, oregano, mint, contain some really powerful antioxidants that even help things like focus. Name a spice, and I'm usually, as a chef, I love all spices, but those are a few that you can start with depending on what your palate is. Maybe you like Mexican food. They use a lot of cumin and coriander and cilantro and things like that. So you can lean into that cuisine. Maybe you like Italian food. It's oregano, salt, pepper, garlic, all of these. Like garlic is a is a rich prebiotic food that helps nurture those gut microbes. So, there's a good one right there.
Thank you. Another question that came up a lot when we were crowdsourcing questions for this Q&A was around the ketogenic diet for mental health. I'm wondering if you can speak on what we know about this and what your thoughts are.
Yeah. So I think that I prefer to talk about the ketogenic diet as ketogenic therapies because ketogenic diet is very specific, quite, carefully regimented by being careful about the amount of carbohydrate intake and really leaning to protein and healthy fats. It certainly has some evidence, a good and growing evidence in conditions like bipolar disorder, certain serious mental illnesses like schizophrenia. But I think the difficulty, and I've written about the ketogenic diet in my book that was published in 2020 and in other places, is I think that it is not a one size fits all for any of these diets that we speak about, including ketogenic therapies. And if you are interested in it, make sure you speak to a provider who's trained in how to use it, because there are specific guidelines to help you put together your food plan, what you eat, when you eat it, so that it's supporting your mental well-being, but you're also following the diet. And without some form of nutrition coaching or someone offering some support, you really have to be careful about how you count your carbohydrates in your intake and that kind of stuff. So it is not necessary for everyone, but it has definitely had some success with certain conditions. I would just caution you to get the right support in place if you want to follow that. Follow the specific diet for now.
Absolutely. And what I'm hearing is that there's no one size fits all with any diet. And that again, that
Correct.
visualization of the different ways up the mountain towards our wellness. There were a number of questions about whether we at Outro work with patients who are also following a ketogenic diet or a ketogenic plan for mental health. We do offer, support on that. We are not ketogenic nutritionists. And so we oftentimes recommend a partnership with someone who specializes in that. But we certainly do support during a taper. And another question that came up was around vegetarian diets or meat inclusive diets. And what are your thoughts about one or the other? Is there ever a medical purpose to recommend a vegetarian diet across the board? Curious your thoughts.
Yes. So I think that what tends to happen in the US is that the media and social media driven narratives tend to kind of propagate one opinion over another. What does science say? There's science on both sides of that. Science that says when you consume meat, the vitamin B12, um, steady level that you get from consuming meat products actually supports depression. There are also a number of plant-based studies that say, well, if you lean into eating more plants, your mood and your overall physical health will be better. This is why I think it really comes to the individual. What is your preference? What are your health conditions? Because nutritional psychiatry, from where we started, has become so much more precision based and personalized. So, if you consume seafood, what can we do to build a healthy whole foods diet for you? A really good nutritional psychiatry plate, so that you're eating adequately. If you have specific goals, and say a provider has told you you need to be giving up certain foods because of certain blood tests that you have, then we have to tweak it to make that work so that your physical and mental well-being are in concert with one another. Because mental health is no longer an above the neck concept, right? It's our brain with the rest of our body. It's the whole integration. So that being said, there's always a way we can carefully tweak what you need based on your condition. And there's a good amount of evidence on both sides. So I prefer to meet my client where they're at. If they come in and say, I eat seafood and I only like broccoli, I'll try to encourage them to eat more vegetables. But if they like seafood, can we lean into different types of seafood that they'll enjoy while keeping that healthy balance from healthy whole grains like quinoa, making sure they're getting healthy fats from avocado or olive oil, but also making sure that they get plenty of vegetables, because that balance for fiber is so important.
Again, I'm hearing that flexibility and the importance of meeting where we're
Mhm.
at, which is so unique for everyone. And that brings me to another question that came up quite a bit of, we know that a good diet includes a balance of fruits, vegetables, whole grains, protein, whether plant-based or animal-based, but buying organic food is expensive and it seems like it's getting more expensive, with
Yeah.
the way,
Yeah.
just
Yeah.
And I'm curious what your sensible ways that you counsel patients are to avoid things like chemicals, pesticides, dyes, buying
Right.
organic if you can.
Right. So I feel as though this is a very nuanced question, and let me explain what I mean by that. Not everyone has the same level of access, and we have to be inclusive of those that have a different budget, and many people do. So I think that a few guidelines I have on this: how we navigate the supermarket physically, walking around. Secondly, what are options that are budget friendly but still healthy for your brain? And also, a principle that I really like to talk about is I would much rather you eat a regular piece of beef that is actual a steak itself than a processed, ultra processed version of it, a bologna, a salami, or some version of it. If you're going to a party and that's what they have on a special platter, that's different. But that shouldn't be what you eat every day. Why do I say that? Because that piece of beef, even if it's not organic, it's still a piece of whole food compared to a processed version. I mentioned once that, rather than drink orange juice, which has the fiber stripped of it and added sugar, just eat the orange. Again, the principle of eating the whole food. So where am I going with this? If it's making that choice and you can get a piece of beef that's not necessarily grass-fed organic, but it's still actual food, I would have that. Same thing with seafood. The actual piece of fish, even if it's frozen, but it's actual fish versus a fish stick, very different thing, right? Because a fish stick is ultra processed, breaded, and probably has some amount of fish in it, but just have the actual piece of fish. How do you navigate the supermarket? Firstly, never go to the supermarket hungry. Drink a glass of water. Drink a glass of water, and drink a glass of water because our thirst and hunger receptors overlap in the brain. So often we are confused. If we get hunger pangs, we actually might be thirsty. The number of times you drink a glass of water and those hunger pangs kind of go away for a bit so that you can shop and not choose all the unhealthy ingredients in the store is always a good idea. Stick to the perimeter because that's usually where the whole foods are, the produce section, the meat section, the seafood section, dairy if you consume that, or other actually plant-based yogurts now. But center aisles are also valuable for budget-friendly options like beans, legumes, lentils that are great sources, canned chickpeas, canned black beans, canned cannellini beans, canned fish, canned salmon. These are all brain healthy options that are cost friendly. Frozen foods in the United States, our frozen foods are flash frozen, so they're frozen at their peak. So frozen berries, frozen cauliflower, frozen broccoli, as long as it's just cauliflower. If it has a sauce, it's usually in a little packet. You don't have to use that. Just use the actual vegetables. And these are good budget friendly options for you to still be eating healthy food. So there are lots of ways to think about it. If I ever see a dollar store, which now is $1.25, in case anyone didn't know that, I always go in to see what are the canned food do they keep. And they often have canned fish of some kind. So this again is an option of actual food that you can eat on a budget.
Thank you for that. And, eating whole foods, eating the orange, not the juice, that's one of your 6 pillars, correct, for calm and anxiety management and mental health care with food. Is that correct?
Yes.
Okay, awesome. Another pillar that has come up that a lot of people had questions about, because again, many of us are navigating nervous system dysregulation, anxiety, sleep changes, mood changes. I'm wondering if you can speak about foods that reduce and support for anxiety, sleep, or mood during a taper.
I think that again, we go back to foundational principles, right? If you are tapering off medication and you're having these different side effects, I know that the stress management things you can do. Breath work is one of my favorites. Having a mindfulness practice, journaling, doing an activity that is helping you keep yourself more centered is important. Improving your sleep would be very important. Are you drinking coffee is not on its own a bad substance, but maybe you need to cut back on your coffee. Maybe you're drinking a lot of tea and maybe that's keeping and disrupting your sleep. Also, while those things independently may not be bad for your nutrition or your health, they may be impacting the way that you're coping with the tapering schedule and that type of thing. So I think it's about finding different things and tweaking them a little bit to see how you can get yourself through the phase. And healthy nutrition and lifestyle factors are always going to be very powerful as you doing that, because we spoke about that gut brain connection. Stress directly impacts the gut and the gut microbiome. So easy way to work on that. I'm a big fan of binaural beats. There are lots of apps where you can listen to that music that is very calming and definitely impacts the body and the mind.
Absolutely. And I really just appreciate the synchronicity between the six pillars of nutritional psychiatry. And then we think about here at Outro the six pillars of holistic health, nutrition being, kind of the bedrock of everything else, but also looking at things like stress reduction, mindfulness, sleep. These are all so important. And I just want to plug as well, we are expanding what we want to offer here at Outro in terms of lifestyle medicine support. So if you're listening in and there's something that you want to learn more about, whether that's meditation or breath work or, just let us know, because we do hope to build this out. We think these pillars are so foundational for well-being during a taper. So we appreciate any and all feedback on that. In terms of this question came up, and again, the question of therapy supports my brain, but what can I do to support my body during a taper? We've talked a lot about some good principles to follow. Are there any other support mechanisms that you have found in your clinical practice that we haven't talked about yet? Whether that are things like wearable glucose monitors or tracking devices or anything like that. I'd love to hear your thoughts on those.
So I think there's a lot of data being collected and a lot of data that people are tapping into out there. I think that, it's a fine line between that driving anxiety and making people feel worse versus tracking that they can use in a meaningful way and interpret to, say, improve health parameters. I think that if appropriate and if there's a concern for pre-diabetes or concern for insulin resistance or type 2 diabetes, it may be appropriate use of a glucose monitor. That's where you do need to go through your provider instead of social media guides on this, people offering advice on social media. So I think what haven't we covered? We've looked at a holistic approach. I guess one of the things we haven't talked about is exercise and how powerful exercise can be, and how when we're not feeling our best, we may not always want to tap into exercise. And my tip for that is what I call snack and stack. And what snack and stack is, it's just like you think about you have a little snack between meals. Think about if it's too overwhelming to go to the gym for an hour, think about doing 15 to 20 minutes every day on a treadmill or half an hour sessions doing a virtual class. Break it down so it feels manageable for you. And as you get used to it, when you start exercising, your natural endorphins kick in and you start to feel better. There's a huge body of evidence for the fact that regular exercise helps our mood, lowers our anxiety. So if you don't like to exercise, you don't feel up to it, or you're just not feeling energetic enough, start slow. Start with a snack and build up on that. And I think that's a very, very powerful way to keep our body and mind in balance as well. I have a lot of clients would tell me when I feel anxious, I get on a treadmill and I do 20 minutes to almost, either cycle or walk fast or run on the treadmill to get rid of that angst I'm feeling in my body. So different people do different things. Something may work for you and not for someone else. So try it out. See what works for you.
Yeah, I love the idea of a snack and stack. Is that what the I'm gonna
Just like you have a snack, you can stack your exercise.
Yeah,
You don't have to do it. You don't have to do all 150 minutes in the day.
exactly. And we talk about that a lot in tapering as well, because sometimes, again, fatigue, anxiety, just not feeling like we want to do a big workout, but can we walk around the block, or
Yes, take your dog for a walk.
can we do a sun salutation of yoga rather than an entire 90-minute class? And I think oftentimes, and I've had this lived experience, we do that and then we want a little bit more and we feel good and we want to keep going. So I think that's a beautiful, beautiful way of looking at it. And, another question that came up was your approach to prescribing lifestyle changes. I think that we see in our current medical system oftentimes that these pharmaceutical prescriptions can be maybe held to a higher esteem or a higher regard. And I love your work that you're trying to change that paradigm. So when you're prescribing lifestyle changes, how does that look practically for a patient?
It depends on what the goal of the individual is working with me. It could be that they are feeling quite depressed and they don't feel like exercising. or they're feeling super anxious and they find difficulty leaving home because the level of anxiety is just too much for them. And they can work at home virtually. And I've had someone whom I worked with on this. So part of it is, how do you find a real life solution in these situations? How do you put together a lifestyle plan that works? So, for individuals who say have struggled, since we were just talking about exercise, I suggest exactly what you mentioned, Charlotte. Can you take a walk around the block every single morning? Go get a cup of coffee, go and buy the newspaper, or go and get something at the local store that you need that day, or take your dog for a walk, or meet a friend that has a dog and walk with them to take a walk with them. Any innovative way that gets you out of that feeling of I can't do something. Because when you enjoy the walk, you start to walk longer distances. Then you think, oh, maybe I can get on a treadmill at the gym and do the same thing. When it comes to winter, I can't walk outdoors. Maybe I can do that. That's important. Another thing that I've really worked on is how in your lifestyle, if it's nutrition, we can start with redesigning your nutritional psychiatry plate with making small changes to start so that it's not overwhelming. When it comes to mindfulness practice, do you conform or do you follow any particular spiritual practice that has meaning for you? You might or you might not, but you can still practice a mindfulness exercise. Do you like to write? Do you enjoy journaling? It's a way to communicate. So, what does a lifestyle prescription look like? It depends on what your needs are, what your condition is, and we can fill in the gaps under these conditions. I had someone who wasn't drinking enough water, and she wasn't drinking enough water because she didn't like to use the bathroom at work. Some people have that issue. If they get on a plane or they're in a public area, they don't want to use the bathroom. So we had to encourage her to be adequately hydrated during the day. So I showed her all the research on, not having enough hydration and what that does to your brain. So we actually instituted getting her a really cool, cute, sustainable water bottle that she loved. She's happy to carry, and kind of gave her little reminders about when she needed to go and refill that water. And she had to kind of get over the fact of where getting over her discomfort of using the bathroom there, because she got to understand how important being adequately hydrated was. So that was part of her lifestyle prescription. So it varies for everyone based on their needs, and we adapt it as we go.
Absolutely. You've mentioned a few times that dehydration can impact mental health symptoms. And there's a wonderful conversation going on in the chat about what is enough water. What do you normally counsel your patients on in regards to hydration?
So I usually give them a general guideline of, 8 cups, 8 glasses of water a day, but honestly, that varies in the literature. Some people need more. I would just be cautious in an individual who's, say, being prescribed a medication like lithium, because drinking a lot of water can suggest a side effect. So if that's your situation, make sure you're speaking to your provider about it. But that's a general guidance. I think making sure that you are sipping throughout the day is just generally a good idea, especially if you're not drinking water. The reason a water bottle helps is it gives you a measure. And if we're just drinking a glass of water here and there, we can't track it. That's why a water bottle that measures and helps guide you is important.
Yep, I've got mine right here. So I'm
I see that. I see that. I love it.
do you ever recommend things like electrolytes or additives into the water, like Element or anything like that?
So if you find something, a lot of these products have different ingredients in them, so you need to check that out for yourself. You also, depending on what your tapering schedule is and what your provider is advising, especially if they're tracking any lab tests, you want to be cautious about not just taking in a ton of electrolytes um, indiscriminately, right? You want to use a little bit if it's okay, and if you're otherwise feeling physically comfortable. Some of the electrolyte powders and things, I do feel they serve a purpose because we might be lacking a certain electrolyte, but I wouldn't suggest that as people's go-to, because there you can add berries, you can add mint, fresh slices of citrus, pieces of fruit to flavor up your water and make it more interesting. But if you are concerned about electrolytes, they're not a bad thing. Just be careful about what brand you buy, what's in them, and see how you feel when you're taking it. If you're on a tapering schedule, make sure your provider knows.
So going back again to that idea of the whole foods, can we add in berries or herbs?
Right.
instead of absolutely. You mentioned with, certain electrolytes and minerals, and one thing that's come up a few times in this conversation is around sleep troubles during a take or improving sleep. And I know you've spoken a lot in your books and research about magnesium as something to help with sleep. I was wondering if you could speak on magnesium or speak on other electrolytes
Yeah.
or nutrients, macronutrients you recommend for
Yeah. So, one of my guidances on sleep support is sleep hygiene. So, making sure that you're eating earlier on the early side, that your food has a chance to digest, taking a little bit of a walk. After dinner is a good way to help metabolize what you've eaten, but also get you tired and ready for bed, and helps your digestion. If you are relying on a glass of wine to help you sleep, it's going to disrupt your sleep architecture. So that's very different from, if you happen to consume alcohol, having a glass of wine with your steak at dinner, it might be the enjoyment factor versus trying to help you sleep. Not shopping at night in bright lights because that's activating your brain is important. In the morning when you wake up, actually being outside in the sunshine, allowing the light to enter your eyes helps regulate your circadian rhythm. Simple hack. And then foods. I like to say have an omelet for dinner because eggs contain melatonin and foods that actually can help just natural melatonin that can actually help calm the system and help you prepare for sleep. There are also foods like that called tart cherries, a specific type of cherry that actually has been shown to help sleep. If you have access to them, fresh or frozen, that's an option too, just to again bring your body into that more calm state. Magnesium, there are lots of Americans that are deficient in magnesium. Speak to your provider, maybe get it tested, see if you want to get an over the counter magnesium supplement. Magnesium is used for many different conditions in medicine. So make sure you're getting the right form of magnesium for what you are trying to treat, and your provider can help you with that.
absolutely. I think you spoke on this idea of getting sunlight in the morning. And I think it's kind of astounding when we start to think about it, just how messed up our sleep can get with our current just way of being and staring into blue lights and not getting outside. And so I'm hearing just a lot of going back to basics, going back to, can you put sun on your face in the morning? Oftentimes in intervention, we'll talk about it outros. Can you put your bare feet if you have access on the
Mhm.
we're so disconnected from the earth nowadays, and that reconnection piece, it sounds like that's something you also counsel in your work.
Definitely. I think we've gotten very far away from those simple basics that we just need to remind ourselves of. I love the idea of, placing your feet on the ground while getting a few minutes of sunshine so that your eyes and your body and your brain know it's time to get up. It's the morning, and it's a good reminder.
And if you can take a couple deep breaths, even better, right? We can start to stack these habits in a way
That's
that's
right.
supportive. Here's an interesting question. Does the probiotic in garlic die off when you cook it?
So garlic has a prebiotic in it, and it definitely changes slightly when you cook it, but it is still beneficial because it contains fiber. So I would still encourage you, I wouldn't overcook it. Sometimes a neat trick that I learned in culinary school is you can make the garlic less sharp in its taste. I mean, if you like garlic, we all know it's flavorful, but not everyone likes it. You can mellow the garlic for a couple of seconds in the microwave, and that softens a little bit without cooking it through. So there's one way to think about it if you're concerned about it.
Try that. Thank you. And then there was another question about pesticides. We had touched on this earlier, but I'm curious if, let's say, we're on a budget buying foods, organic foods, we have a limited budget for produce. Are there a couple different fruits or vegetables that you would advise focusing on to buy organic?
Right. So I'm going to put this in the chat. There is the environmentalworkinggroup.org, and every year they put out the Clean 15 and Dirty Dozen list. These are foods which they've assessed to have. Clean 15 are the ones you can save some money on and get non-organic, and Dirty Dozen are the ones you should try to get organic. Strawberries are usually the top of that list, and we know that strawberries are great, rich in polyphenols and great nutrients for our brain. My suggestion is buy them frozen and organic, more cost effective. You still get your strawberries, and it's a way to navigate that. So I don't think it's a perfect world. But if you can, these are some good guidelines. Usually they put out these lists that are easily available on the internet or social media. And I use them as a guidance. It's not a perfect world. I think it's important for us to understand that even something that is organic may have a slight trace of pesticides in them because of our environment. But again, it's all about, can we make this healthier? Can we move in a healthier direction? And I think that's a better way to think about it.
Absolutely. And then if we are eating frozen fruits and vegetables, say, is there any loss of nutritional value in freezing?
No. So when we buy frozen foods or vegetables, well, I'm talking now about vegetables and berries. They are flash frozen in this country, so the nutrients are actually upheld in the frozen food. So that's always a really good option for you versus canned, say canned green beans, not much nutrition in them, but canned legumes, so canned chickpeas, canned black beans, or canned fish, actually pretty good with the nutrition. Just with the beans, rinse out the liquid they come in.
That's so helpful. Thank you so much, Dr. Uma. And we've got just about a minute. I just want to thank you. There's so much gratitude coming through in the chat about just your wisdom and your research and what you're doing in the world of culinary and nutritional psychiatry. So we really want to thank you for being
Thank
here.
you. It's been fun being here. I appreciate the good questions and everyone being interested.
Yeah.
Best of luck with all of this.
Wonderful. Thanks to all of you. Gratitude is a core piece of holistic well-being, and we are just so grateful that you joined us on World Mental Health Day to talk about this. And if you'd like to learn more about Outro's tapering and lifestyle medicine programs, visit us at outro.com or follow along on social media at Outro Health. And then this recording will be shared via email and on our YouTube channel, usually within a week or so. And two people have already said, please come back, Dr. Naidoo. We would love to have you again. So hopefully we
Thank
can
you.
again soon.
Definitely. Thank you so much. Nice to talk to you, Charlotte.
Awesome. Thank you so much. Have a good rest of your day, y'all.
Thank you.